Good evening. It is hard to believe only a week ago tonight we had only 2 confirmed cases of coronavirus here in Michigan. Today there are 65, and the true number probably much larger than that. Concerns over what Michigan will look like 7 days from now has hospitals ramping up.
This issue of surge capacity is real.
Doctors and nurses are preparing for a storm they know is coming. Every day that goes by, Michigan's hospitals are further stressed, and we know, at least for the foreseeable future, it will only get worse. Today, we have just over 25,000 hospital beds in Michigan, but most of those are full, in part because of things like the flu. That means that as of earlier this month, only about 6,400 beds are available.
If the worst case scenarios play out, there's going to be the need for urgent plans to be implemented, the development of new hospital capacity.
Brian Peters is CEO of the Michigan Health and Hospital Association. For weeks now, he says hospitals throughout the state have been working on plans to increase capacity, adding more beds, more ventilators, more masks. At the University of Michigan in Ann Arbor, the hospital is opening 32 private isolation rooms specifically for coronavirus patients. The unit uses negative pressure systems that make it harder for disease to spread through the air. At ASCENSION Health, hospitals are arranging for expedited shipments of hospital supplies, and they've implemented conservation measures so things like masks last longer. And knowing that some doctors and nurses will be infected by the disease, hospitals across the state are trying to add staff too, so that patients can still be treated even as staff fall ill.
Tapping into retired physicians, retired nurses, and other caregivers who may be in a position because they've maintained their license.
This is an all hands on deck approach. It needs to be, because very quickly the number of people needing attention is going to create greater stressors on our ability to meet that need.
And to free up bed space even further, some hospitals are canceling elective surgeries. Others say they will be releasing patients sooner than they might otherwise want to, all in the hopes of avoiding a worst-case scenario. We're live in Royal Oak outside Beaumont. I'm Ross Jones, 7 Action News.
Ross, thank you for